to order. If we can get a roll call, please.
Councilmember Perales?
Here.
Councilmember Jimenez? Councilmember Carrasco? Councilmember Vice Mayor Jones? Present. Councilmember Arenas? We have a quorum.
Thank you very much. And then we have nothing recommended to be added or dropped. If my colleagues don't have any changes to the work plan, we can move to approve. Move to approve. Thank you. Second. All in favor say aye. 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 Consent calendar. We have one item. If we can get a motion to approve that. And I don't have any cards for that. And sorry, before we vote, if anybody would like to speak on any items on today's agenda, including this consent calendar, you can turn in a card. Sean Kelly Wright, would you like to speak on consent? Yeah, we have one. Please come on up. And if anybody else is here would like to speak on any items, just submit a yellow card and we'll call you up. Sean, welcome.
Honorable Chair, members of the Council of the Finance Committee, Sean Kelly Wright, lobbyist for the Silicon Valley Cannabis Alliance. The budget looks fine. I just want to talk briefly about the revenue for cannabis on page 12. Although the revenue is down a little bit, the market is still strong. Our biggest competitor is still the illegal market. State taxes and local taxes, being what they are 44% higher than what you can buy from a dealer on a website, from Facebook, from Instagram, from any of the other social media, from Craigslist. And that's where the majority of the crime is really coming from also in those areas. So I've asked before, and I'd like to see some sort of conversation, and I believe you'll probably have it in the coming months, regarding a reduction in the sales tax. The state is considering it. We just need it to be more competitive with the illegal market. The illegal market, you can see also the negative impacts of it are the vaping issue. The bulk of the vaping problems are coming from THC products in illegal vaping products and vaping from the illegal market, and that's really a problem. It's too easy to go on your mobile phone, and it's too hard to discern what's legal versus illegal other than kind of knowing what is here. And it's just, I mean, we'll drive across the street or we'll drive around town looking for 5 cents cheaper for a gallon of gas. 44% is substantially higher. So I just ask respectfully that we kind of look at that and how we can reduce that. I know we're looking at expanding the market itself here legally in San Jose, which will combat the illegal problem, but cost is a huge factor. And so the more we can get people in the legal market, away from illegal dealers, the better. And so the only thing I'd ask is, in the coming months, having that discussion. Thank you.
Thank you. Any comments or questions? And if not, I'll take a motion.
Motion to approve.
A motion and a second. All those in favor say aye.
Aye.
Aye. Motion passes unanimously. Thank you. Now we're on to item D1, the report on our personal care business compliance initiative follow-up report. Welcome.
Thank you very much. I'm Lieutenant Paul Messier. I am the lieutenant in Special Investigations. With me today is Sergeant Rick Galea. We have Kimberly Gutierrez here, who's the program manager at Community Solutions, and Sharon Denoa, the director of strategic development at the South Bay Coalition to End Human Trafficking. So it's been a year since we spoke to you on this subject. So what we're going to do is kind of go over the last year, and we're going to start off with a little bit of the history of the illicit massage businesses in our city and what we've done to deal with it. So in 2017, the Personal Care Business Compliance Initiative was added to the priority list as number 10. In September of 2017, the Vice Unit reported that the Personal Care Compliance Initiative could not be implemented because of staffing shortages. But there was a change in that, and we were able to get a code enforcement officer dedicated to this, as well as the vice unit sergeant position restored. So in 2018, we implemented a new program that resulted in the closure of 107 illicit massage businesses. And because of that, council voted to remove item 10 from the priority list. So once we gave our presentation, the direction that we received from council was to expand our collaboration with our nonprofit providers and other leaders in the field to increase their participation in providing services to victims of human trafficking during vice operations on massage parlors. We were then asked to report back to this committee on the progress of enacted massage parlor best practices interventions for human trafficking survivors. So here's a snapshot of our enforcement, prevention, and intervention program for this last year. It consisted of a collaborative effort between Vice Code Enforcement and the City Attorney's Office, continued covert operations at suspected illicit massage businesses. We continued with the landlord education program where we educated landlords about illicit massage businesses. And then the new component to our program is the last one there. We partnered with Community Solutions as well as the South Bay Coalition to End Human Trafficking. So here is kind of our history of the results of our efforts. So initially we identified 191 suspected illicit massage businesses in the city, and we compiled this list from complaints from the members of our community, illicit websites, as well as the heavy clustering that we were seeing in various locations. So last year we reported to you that we were able to close 107 of these businesses through covert operations as well as the landlord education program. This year we were able to close down 79 more. However, we added 55 additional illicit massage businesses to our master list, and the reason why we did that, there's a couple reasons. It was a little bit of whack-a-mole. We had some that closed that resurfaced in different locations. We were able to find ones that were kind of hiding in plain sight, posing as other types of personal care businesses. And then what we did is, because we shut down 107 of them, the sex buyers stopped leaving reviews for these places. So we were still seeing quite a few of them on rub maps. However, there were no reviews, so we really weren't sure if they were illicit massage businesses or not. So we added them to our list to verify exactly what they were all about. So that's why we added those additional 55. So in all, over the last 2 years, we have 246 identified, and we've been able to shut down 186 of them, about 75%. So here's a snapshot of the current operating status of the massage businesses in San Jose that we focused on. We have 18 that we suspect will be closing within the next 6 months. We have only 6 left where we have not taken any action. So they haven't been subject to the landlord education program or a covert operation. In red, we have the 186 that we shut down, and then we have 36 where no commercial sex was found to be occurring. So here's our activity for this year. The Vice Unit conducted 82 covert investigations and 21 landlord education meetings. And Code Enforcement, who's a major partner in this program, did 320 inspections, 51 compliance orders, and issued 30 citations. So over the last 2 years, we did a total of 142 covert operations, and what we determined is 75% of those businesses were offering commercial sex. Another way of looking at this is 75% of these businesses, there is a potential for human trafficking to be occurring. We were just unable to verify that at that time. We are continuing to see improved compliance of persons submitting a massage business application. It was 67 last year, up from 7 the year before. This year, it was 31. So still significantly higher compared to previous years, which is good because it shows compliance and that the education component of our program is working. The word's getting out that you actually need this permit if you want to open up a massage business in San Jose. So some of the trends that we're seeing, we are still seeing other personal care businesses offering commercial sex, primarily in hair and nails, skincare, acupuncture, and in barber shops. These businesses do not advertise on the primary websites that we look at. However, we do find them on escort websites. So this is an example of a business that was over in the area of Alma and Almaden. You can see in the picture here the windows are totally tinted out. They don't really have a real sign. It's just kind of a banner. And then in the right corner there, I know it's difficult to see, but you can see a surveillance system set up. So these are all red flags to us. Additionally, this one was advertising on a website called BedPage, which is an escort website, and they said that they were doing waxing for men with a guaranteed relaxing and enjoyment experience with heart-shaped emojis on each side. All red flags that there's more going on here than waxing. So we did a covert operation at this one and sure enough discovered commercial sex was being offered. In a very similar situation, we had a place called Paradise Barber where we actually brought, for the first time ever, we brought in the Employment Development Department as well as the Department of Labor. And they brought the manager of that illicit massage business to court, and the court ended up fining her $1,500 per employee that she did not have workers' compensation insurance for. Here's another challenge we face, completely covert illicit massage businesses. So this one had a sign up called TD Printing. It was over near Tully and Center. They're very difficult to find. However, they do have to advertise. That's how they bring in the money. So it takes a little bit more work. Usually there's only a phone number that's advertised and maybe a picture. And we have to do different investigative tactics to actually track down the location. But we are able to find them. And when we do, of course, we do a covert operation to confirm pretty much what we already know. The person running this one we were familiar with. She had 5 other illicit massage businesses that we had conducted investigations at throughout the year, and the district attorney charged her with felony pandering after this one. So this is a glimpse of our city with the 246 massage parlors that we have identified over the course of the last 2 years, with the heaviest clustering in the area of Tully, in between King and Quimby. We had 25 within that one small quarter-mile distance there. And this is what it looks like now. So what you're seeing here are basically the 24 that we have left. We have 6 where no action has been taken yet, and then the 18 that are operating that we suspect will be out soon within the next 4 to 6 months. And if you look at Tully and King now, which is the ones farthest to the right in the middle, we only have 3 left, and that was, like I said, once 25. So now I'd like to talk about our new partnership and our best practices that we implemented for human trafficking survivors. And I just want to say we worked collaboratively with Community Solutions and the South Bay Coalition to End Human Trafficking to put these best practices into play. And we really took a victim-centered approach when we put these different ideas together. So the first best practice is we are no longer arresting sex workers in illicit massage businesses. Historically, the Vice Unit has taken a zero-tolerance approach. We usually either issue a citation or we make an arrest when we discover commercial sex. What we do now is we document the incident. We'll submit it to the district attorney for review. But what we don't want is this. We don't want to arrest someone who could potentially be a human trafficking victim. The other thing that this does is it creates a much less stressful environment in the massage parlor when we are not arresting someone or putting them in handcuffs. And we feel that will create an environment where a potential victim of human trafficking will feel more comfortable disclosing to us, which is what we want. Our next best practice is we provide brochures to all of the employees in these illicit massage businesses. These brochures are provided by AACI, Asian Americans for Community Involvement. We distribute them at all the illicit massage businesses. It really does close the language gap because we're able to get these in various languages. These brochures have all kinds of information, but in short, they provide resources, a 24-hour crisis hotline, legal help, and so forth. But look, we understand as law enforcement, obtaining a disclosure from a human trafficking victim through an initial interview can be challenging for a police officer. So, and that could be for various reasons. It could be the stigma that goes along with recognizing as a victim in a commercial sex industry. So we feel by at least giving them these brochures, even though they may not feel comfortable right then and there may be a time later where they do feel comfortable and they'll have that information in hand ready to go. So our next best practice we implemented is we now have advocates responding to our Vice Unit operations. Community Solutions, YWCA, and AACI partner on multi-victim operations. So the way it works is this. We notify them in advance when we're planning to do one of these operations. Once we confirm commercial sex was being offered, we will give them the location, and they'll usually be staging. And then we will actually leave, but we will have one officer stand by to provide security for them as they provide information on services. And to me, having the advocates on site is really the most powerful component of our new program. And for some survivors, it's through this process of education, awareness, and case management, all the things that an advocate in these organizations can provide, that an identification of being trafficked is revealed. So it's definitely a force multiplier having them out there with us when we're doing these operations. So what I'd like to do at this point is turn it over to Kimberly Gutierrez with Community Solutions to kind of talk a little bit more about our partnership.
Thank you, Lieutenant Messier. First of all, I just want to say how glad we are to be collaborating with the San Jose PD Vice Unit to make sure that these potential survivors are connected to a confidential advocate and they're able to have the information as well. Here in Santa Clara County, we utilize the point agency system where law enforcement, governmental agencies, and community-based organizations can contact one agency for any human trafficking service need. And here in Santa Clara County, that's Community Solutions, and we've acted as the point agency since 2007. We work closely with the other victim service providers to ensure that a confidential advocate can be assigned that meets the survivor's linguistic, cultural, and geographic needs. The point agency system, as Lieutenant Messier mentioned, we also use that for any multi-victim operations to ensure that we can coordinate with these other victim service providers to make sure that there are advocates available, as well as we have resources coordinated to meet their needs. Through collaboration with the Vice Unit, advocates from Community Solutions, YWCA, and AACI were able to respond to multiple locations on 6 separate occasions, connecting with 19 potential survivors. Advocates were able to inform these survivors about our role, our confidentiality, and the services available to them. We were able to also ensure that if there were any basic needs, that they needed shelter or food or medical attention, that we could address those right away, as well as talk about different resources that were available to them. Different resources include connection to legal services in case they do require legal advice around immigration, around employment law in cases that there may be wage theft occurring as well, or any other civil remedies. We also would safety plan with the survivors to ensure that they felt safe after they left with us. If they consented, we would follow up with them at a later date to ensure that whatever services, whatever support that they needed, we were able to address that right away with them. Thank you.
Partnered with the South Bay Coalition to End Human Trafficking, and we partnered with Sharon Denoa, the Director of Strategic Development, and Vice assisted in the drafting of a report that she recently presented, and that report was called A Regional and Countywide Response to Illicit Massage Businesses or Establishments. And this report was presented at the county's Children's, Seniors, and Families Committee earlier this year. And we have had ongoing discussions with her about different regional approaches that we could take. And one of these approaches is right here. So in Sharon's report, she talks about the need for a collective impact approach to deal with illicit massage businesses. So, and specifically to identify networks. So what we've done is we've established a illicit massage business LEAP program. And what it does is it allows for countywide information sharing by tapping into law enforcement databases and RMS systems. So LEAP, it's a confidential law enforcement website that we can log into. It's very similar to Google. It has a search bar. We have 120 law enforcement agencies in the state that participate with LEAP, and every city in our county has an account. So this was the clear choice to use this system for this program. So we have already migrated in 106 illicit massage businesses that we have confirmed in the city of San Jose, including the individuals that were managing those businesses, their phone numbers, their email addresses, whatever information we had on them got migrated in and is now searchable. So what this does is twofold. One, it's going to stop the migration of illicit massage businesses into other jurisdictions, which we have seen, and I'm going to have Sharon speak about that in a moment. But the other thing that it's going to do is it's going to help fight organized crime. So in the Polaris report, which was a national study on human trafficking, it's cited that the average illicit massage business connects to at least one other illicit massage businesses, and it specifically named California as having the highest number of these connections. So the way it's going to work is this. If a massage business gets kicked out of San Jose because we find that they're offering commercial sex, and they try to go to Milpitas PD is going to process their massage application, and they're going to check LEAP and see that this individual has already been kicked out of one city. They're going to deny his application. So that's one example how it's going to stop the migration. How it's going to stop organized crime is, we have human trafficking teams that are dealing with organized crime, and they'll actually be able to see, hey, look, this guy has had a massage parlor in San Jose, he's applied for one in Milpitas, and now it looks like he's got one in Oakland. So they'll be able to kind of put the pieces together that this is actually somebody who has a network of illicit massage businesses, and it will greatly help them in their investigations. So the next phase of this project is going to be education. We just put our information in here. I tested it yesterday. It's all there. What we need to do now is reach out to each agency in our county, explain to them that our information's in there. They need to migrate in their illicit massage businesses that they've kicked out. And then we need to get in touch with their permits units to make sure that they're searching the names of the individuals that are applying for these permits in their cities. Okay, I'm going to turn it over to Sharon Denoa now to speak about a couple charts from her presentation to the county.
Thank you. So this chart was actually created by Bassem Banafa. He's a forensic accountant that worked with us on this report that we presented to the county in June, we got an update on it. So you can see that from 2016 to 2019, there's been a significant shift. San Jose is the upper line, that blue line. So in 2016, you were starting with 157. And I should also note, so these numbers were pulled from RubMaps, which is a review site. So there are some reliability issues, but it still gives a sense of prevalence that we can kind of gauge patterns from. And so you can see San Jose's number has been steadily declining, largely because of these efforts from the Vice Unit in San Jose PD. But every other city in Santa Clara was seeing an increase. You see a slight decrease as well this year, and I think it's because we're seeing more engagement from a lot of jurisdictions in how to approach massage establishments. And I should also note that Polaris report looks at California, but specifically with regards to San Jose. San Jose was named as a nexus city. So San Jose's massage establishments have connections to a lot of massage establishments in other jurisdictions. So one of the big things that we really tried to highlight in the report is that there really needs to be a regional approach to this. We're already seeing in terms of trends that San Jose has been able to really shut down a number of massage establishments, but they are popping up in other cities. And this is only reflective of Santa Clara County. We know that this is happening in San Mateo and Alameda County, Contra Costa County as well. So what we really want to encourage is being able to share a lot of the learnings that are happening here, the information on the criminal side, but sharing administrative and civil approaches so that we can really have a regional approach and really talk about how we're able to better serve and identify survivors, because even if they're closing down, we're not able to provide services to a lot of the survivors. This chart, I think, is important, and I should note this is from 2018, so it hasn't been updated to the newest numbers this year. But it's looking at the number of massage establishments from 10,000 per 10,000 residents. And so we have been focusing really heavily on San Jose because of the sheer number of massage establishments. But when we're really looking at the number of residents, we see other jurisdictions really have vast overrepresentation, again, bringing us back to that need for a regional approach. I'll also note that in our countywide report, I did a number of interviews with code enforcement, law enforcement in other jurisdictions, and they're seeing adaptation. So even though the approach Vice has used with massage establishments has been really effective in shutting them down, we know that we're seeing a shift to residential brothels. Those are harder to identify. They're not going to be, you're not going to be able to find those on the same websites that we're talking about. And we're also seeing adaptation to the acupuncture where it falls under different ordinances. So we're really trying to encourage that collective impact approach can also be seen maybe as a task force or a different model where we're increasing partnerships across jurisdictions. I really see San Jose taking a lead role in being able to encourage other agencies in our county to share information, to share different approaches, and really attack this problem together in a regional manner.
Okay, so in conclusion, this year our program has continued to show a lot of success. Our plan moving forward is we're going to continue to target illicit massage businesses as we find them. And we're going to implement our existing program and our newly implemented best practices. We're going to continue to collaborate with our nonprofit partners to provide resources to potential human trafficking victims. And we're going to continue to develop the illicit massage business LEAP system and reach out to local law enforcement to get them to participate in that program. Any questions?
Questions from my colleagues? Vice Mayor Jones?
No questions. That was an extremely thorough and comprehensive report, and I want to thank you for that. And looking at the results of your efforts are very impressive. I have no questions. I just want to commend you on all the good work that you're doing.
Thank you.
Councilmember Arenas?
Thank you so much for this report, and not only for the report, but all of the great work that has led to this wonderful report. This is such a a huge difference between what we saw last year, and I think the work was great even back then, because the point of this all was to close these illicit massage businesses, and that's what you were achieving. And I think what I see now is also some of the efforts that include making sure that that the human trafficking element is also addressed. And so I'm extremely proud, just absolutely extremely proud of the work that you're doing. I couldn't be happier with this, and it is. I think this was some of the joy that we get when we ask a lot of questions, maybe, and when we see a police department that is willing to take the challenge and addressing it and finding partners that make sense for some of our victims out there. And so I'm just extremely grateful to you for leading this charge, for getting us where we are right now. So I just wanted to start off with that. I'm just extremely happy, so thank you. I do have some questions about some of these next steps. I know that you said that because some of these, and it's so strange how this very, I think it was TD printing or something like that. It just looked very innocuous. It didn't look like a place where illicit massage businesses was being established, but you managed to find them. And so I imagine that you're also taking some work that's leading you into these residential brothels, right? One of my concerns was last year was that when we push these folks out without having a regional approach, which is now I see you're really taking this regional approach, so it's not making it Milpitas' issue, it's not making it somebody else's issue, it's an issue that we're all addressing together. And so I wonder, one, how are you seeing the residential brothels? Because if I were to guess, I'm going to guess that they're going to be in some of our disadvantaged communities. And are they there yet? And I'm guessing the same way that you have this educational program for landlords, that you'll also have an educational program or something equivalent to that for landlords of property owners, if that's really where they're going. But let me give you the opportunity to answer that question. Where do you see them going next?
Well, you know what? When we push these businesses out of San Jose, you know, it's no secret that we did see an increase in residential brothels. Our unit specifically gets tips about these, just like we do about the massage parlors. Tackling these residential brothels they're much more labor intensive because you're dealing with a residence, not a business. With a business, you know, we can do a administrative check. We can go and check permits, things like that. When you're dealing with a residence, you actually need probable cause and a search warrant to get inside. So our bandwidth is the vice unit. I mean, Rick is and Dan Anderson are my only two vice people. We have to bring people in to help us with the massage parlor operations. And really, and I'm sorry to say this, we just have not had the bandwidth to tackle that problem. However, moving forward, you know, now that we have this illicit massage business problem under control, I think what we can do, and Rick and I were actually talking about this today, different strategies on how we can tackle that problem, different things we can do. One thing for sure that we can do is use LEAP and at least get the information that we're getting about these illicit massage businesses into that system, so other jurisdictions that may be working these human trafficking cases can actually make a connection with what we have going on here in San Jose. When we do get those tips, we don't just bury them. We actually give them to our sexual assaults unit, and they give them to our human trafficking unit. So it's not like nobody does anything with them. Additionally, We do bring in officers on overtime, and they will actually go. We tend to see these more in apartments than actual residential neighborhoods. And what they'll do is they'll go in and set up maybe 3 apartments. So if one gets shut down, they still have 2 others operating. But they will actually go and make contact with the management at the apartment complex and tell them what's going on and ask them to evict them. Sometimes that has actually worked. Other times it is not, because of course they want proof that it's going on. But these types of operations take surveillance. They take a lot more work than what we do with the massage parlors, and that's the challenge with them. So it's certainly something that I think when we talk about regional approaches, one of the things we're going to continue to talk about with Sharon moving forward, different ideas on how we can tackle that problem and maybe pool our resources with other jurisdictions to deal with it.
I think, well, that sounds a lot more difficult, right? And it sounds like you will need a lot more resources. One of the things that you don't have, that you do have in the residential areas are nosy neighbors, though, right? And
They're usually the ones who complain.
right, yeah. So that's one advantage, and especially in apartments where you're living so closely with one another, that whatever that business is, that if they don't agree, they will hopefully share that with others. So I think maybe that is a direction where we might have some benefit in terms of making an investment in educating some of the folks living in multi-housing apartments that you suspect that there's activity happening, and using your neighborhood association groups that are already existing and have some kind of a force to be reckoned with out there, as well as some of the service providers that are supporting some of those groups that have probably gotten neighborhood associations their strength and their ability to organize, because that's what we rely on. We rely on these service providers to do some of that work, as well as Project Hope, right? So Project Hope is in some of the areas where you probably have an overlap with some of these issues, and maybe gangs and whatever other crimes that we typically see in Project Hope type of neighborhoods. And although this is maybe a problem that will never end, it is definitely a problem that the strategies that you're taking are absolutely victim-oriented, that they're comprehensive, that there's a regional approach here that really makes sense. And as much as I can support you, let me know how I can do that, how we can continue to support you to carry on this work. And it sounds like you have only 2 vice unit members who can really do this work?
Yes.
Wow. So how does that work out? What does that mean? Because if you're taking a look at, does that mean that you can only close 1 brothel per quarter? I mean, what is that?
This is one of the challenge, and this is really why we created the landlord education program, because that is something we can do without covert operations. We can get the landlords down to the PD and educate them about human trafficking and the fact that they've got a bad tenant. So we've been able to kind of augment the enforcement with that, and that's something that doesn't require a ton of resources to do. So that's why our program really was so successful, because we were able to close a lot without any enforcement. But the bottom line is we do have to bring in guys for overtime to help us with these operations. When we go into a massage parlor, we don't know what we're going to find. We have individuals in there. Some of them are criminals that are receiving these services, so we have to be prepared, and they are very labor intensive to set up and to put on. So it's been a challenge, but we do find resources, and we've been successful just working with what we got.
I know that the county is also having, we're having some joint efforts in terms of issues, this being one of them, have you worked with the county at all in terms of what their resources are? Obviously, you know, that you have a service provider that's a point agency and who helps coordinate all of that. But what about the county resources for maybe some of those victims? Have we tapped into those resources?
No, we have not, but I will say we have reached out to the Light Task Force to coordinate with them regarding the apartment brothels, just to see how they're tackling it and what they're doing, and just collaborate and just to see if they're seeing the same thing we are with the increase of the apartment brothels. So we have done that.
Great. You know, one of my fears is that when these brothels are in residential areas, and I prefer the apartments because people get to be a little nosier than in a single detached home where, you know, you only have two neighbors, one on each side. Well, maybe the neighbors in front of you. But when there's more set of eyes, I think it's better for these criminals and for us to figure out what's happening. And I would love to stay connected with this because my fear would be that then there could be more minors involved, right? When nobody's looking, when, you know, and these minors can be in that apartment or in that home for a relatively longer term while people figure out what's going on. And can get transported out relatively easily. But I like that you're working with Late to make sure that you're taking advantage of all the resources that are out there. I wanted to ask you about how many jurisdictions. So you talked about LEAP and having inputted all that information or migrated all the information about the individuals, their businesses, and all the relevant information. How many more jurisdictions have you connected with so far? I know that part of your effort is to reach out to them and let them know about this so that it can be a regional approach. How many are in our network so far?
So we just finished migrating in our information into LEAP. The second phase of this project is actually going to be the outreach. So we have not reached out to anybody yet, but that will be the next phase of this.
Great. I look forward to it. What's the plan? What's the work plan for that?
Well, I think talking about it with my partner here, I think what we're going to do is it's twofold. We need to figure out who's doing human trafficking investigations at each of the departments in our county, figure out who the point person is for that. Then we also need to figure out who the point person is in their permits unit, because their permits unit are the ones that are going to be getting these applications. So we need to figure out who the point person is for that. So I think our plan is to actually go to each department, figure out that information, and then arrange to have a sit-down meeting with each one of them. And they all have LEAP accounts. So if they don't have an account, we'll assist them in setting one up, and then we'll actually show them how to log in and how to get to our list, what it looks like, the format, it was basically an Excel spreadsheet with all of the pertinent information. So we're going to recommend that they do the same thing, that they use the same format, and that we will put them actually in touch with the LEAP law enforcement liaison that assisted us, so they can assist them in getting all of their information in there. And then it's really on them at that point, once we educate them and tell them what they need to do and why they need to do it, that they actually be proactive and do it.
I think you're onto a best practice that will lead to regional success of definitely decreasing this type of crime. Hopefully one day eliminate it, but absolutely decreasing it. I think it's worth our efforts to invest in resources to make sure that happens. Otherwise, it's a game of, Milpitas, you have this issue for now. 6 months later, it'll be back in San Jose, in some portion of San Jose, or somewhere else, and it's no benefit to any family. It doesn't matter whether they live in San Jose or outside of San Jose. I know our interest here is San Jose, but my interest is really, in general, just all human beings deserve to have the protection of our police officers, and I'm just extremely proud that I think we're onto establishing a really best practice, a regional approach that I hope that our city manager's office, and if I know anything about our city manager's office, and she's been wonderful, Jennifer McGuire here sitting next to me, has just been fabulous in getting a lot of our work plans steadily moving forward. And of course, both of you, doing the great work that you're doing to get all of this done. I think this is something that's worth really investing in terms of next phase. I think it makes sense to have LEAP, to have an online network that allows for all of this to fill in all of the missing pieces of the puzzle without having to spend so much time. I think it's just absolutely a great way to do this. It's effective, it's efficient. We just need to make sure that the rest of the agencies are invested as much as we are, and that they can get ahead of the problem if the problem isn't there in their city just yet. And you have an advocate in me to do any of this work, to get you to the next phase of this work, because I think it's not done. You know it's not done. You know that you're going to pursue this into the next phase of wherever these criminals take us. And so please count on my support to address the next phases, because as I see it, and as we saw not too long ago when you all were there for that 14-year-old who was kidnapped and forced into sex work, it's one and the same, right? She was performing sex work, but she was also a victim. And, she was somebody's daughter and somebody's sister, and that's really important for me to have us to continue to think of the women and the men who are involved on the other end of these crimes as these human beings that we need to get to, and that unfortunately these criminals are very savvy and have their networks, but we can do better, right? And I am seeing that by the work that you're showing us today, that we are one step ahead of all of this, and so I'm just extremely proud. Thank you for the work that you're doing, our service providers for being there for our victims, for adding that other element of support that I think is making a huge difference, and so I thank both of you. But thank you once again. I think that's all the questions for me for now, but thank you. Thank you for all the great work that you're doing, and thank you for reducing those three, I think from, God knows how many, but now we only have 3 dots on my district and in that side of town, and I'm just absolutely proud. Thank you.
Thank you.
Yeah, thank you. I'll echo that thanks. This is a lot of hard work, and when we came out the gate on this a couple years ago, recognized we missed a couple points, and so we came back at it and really were bullish on shutting down these businesses in the city of San Jose, primarily with our police resources, although very few, and we're extremely successful. And although we were very successful in that regard, as we came back and had the discussion, Councilmember Arenas actually led that conversation in regards to saying, well, how can we then take it to the next level, right? And now that we've addressed this sort of overwhelming, need to address the problem of illicit massage businesses, to then now see how we can partner better. And I really want to echo that as well. The thanks that from last year to this year, the partnership seems like it's very strong. The policies we put in place, the practices as we're going out and investigating and then shutting down ultimately these businesses, sounds like that was worked through very collaboratively. And now, specifically, I think we are also looking at it regionally. And rather than just, I think being proud of the successes here in San Jose, but knowing well, it's just moved over to Milpitas, right, or another neighboring city. We can feel proud that we're working collaboratively and potentially, working towards ending this business practice altogether in the region, and really making a major impact. So I am also excited in the fact that we've been doing this ourselves with, certainly yourself, Sergeant, the two, bodies that you have, meaning one being yourself, and then the partners that obviously when you go in though and do a covert operation, the other officers that come on board, and then our nonprofit partners here in the county. And Lieutenant as well, thank you very much. A very thorough report. I will ask, as we get a motion, I have some questions, but that we ask you to come back again. I do appreciate the annual report on this. It's not a standing item. There may be a time when either I'm not chair or somebody just decides they don't want to hear it anymore, but at the moment, I really like hearing it. And so at least on an annual basis, to have you come back and provide that update. And I understand it may take, obviously some time to put this together. I would say that this is extremely, thorough and not necessarily demanding that it always be this thorough, but that we at least want to get that update on an annual basis and to kind of hear from yourselves. And because the questions, over the last couple of years did involve a lot about, well, what are we doing for these potential victims of human trafficking? And unfortunately, we're directed to our officers, right? And the reality is that, well, that's not within your wheelhouse, so we needed a partner. But the reality was that we needed our nonprofit agencies here, right, so that we can ask those questions and get that update. So I also thank you for including them and allowing them to be part of the presentation to give that feedback on their end for the work they're doing, because that's really where that effort needs to be driven from and led through. It's not the police operations portion of it that they're doing, and so we want to be able to hear from them. So I thank you for that. I did have a couple questions. So the 36 businesses where there was no case made, I wanted to get an idea of, well, first off, what happens to those 36 businesses? It sounds like from what I'm reading, they're sort of removed off of the list. And I'm curious how many of those is still, I guess would be a red flag, or where we would consider, well, maybe we just didn't catch it at that time, or did we actually determine, no, these businesses were legally operating as massage parlors, and so there was no illicit business going on or illegal business going on. So I'm curious about that.
So it's kind of all of the above. Even though we weren't able to make a case, it doesn't mean that we aren't going to try again. It may have.
So do they stay then on that list? Because it seems like they dropped off.
I took them off just to kind of show you what we're focusing on, but we may go back to those businesses. Most of them appeared to be legitimate. However, most are also unpermitted. So whenever we have that kind of situation where we will encourage them to apply for a permit later to make sure that they go through the entire process to become a legitimate business. But obviously there are times where we go in and we're unable to make a case, but we see things, we have some intuition that there may be more going on there, and maybe there's just heavy vetting going on of new customers. So when those situations arise, we take note of them, and there are ones that we may go back to.
Okay. I guess I'd like to see then the way that you broke it down this time. Didn't tell that whole story. So I would like to see maybe next year, if you, within the businesses that we sort of have not, made a case on, but yet they're still in the list and they may not be a priority, but we will come back to them just to, it could even be in the pie chart of some sort, right? That would just determine that no case made yet of some sort, right? So, but thank you for the understanding on that.
Sure.
The business, like you mentioned, the LK facial skincare. So is it safe to say, like for this business, if somebody was to go in and they actually wanted to get the facial, that they would say that they just, it's not like they don't offer actually that, or what do they offer some of these services that they're advertising? The printing as well? Do they actually do printing there, or no? Is it like, so if somebody walks in, are they going to be surprised?
It's actually the same thing we see in the massage parlors, and some of the complaints we got have been women that have gone in trying to get a legitimate massage, and there's no wait Well, they get turned away. And then they'll be standing around wondering why, and all of a sudden a man will walk in and will immediately be ushered into a room. So it's the exact same thing with LK Skincare. They had salon chairs in the front that they weren't using, and they had about 5 rooms in the back where they were doing the commercial sex.
And what about the printing?
The printing is a straight up brothel. It's a covert, I call it a covert illicit massage business, but their model, the way they're operating, it is absolutely a brothel. It's advertising on an escort website. Anybody who goes there is going there for commercial sex. There is, although they did have a copier in the front room as kind of a way to kind of, I guess, make people think that they were a legitimate business. They absolutely were not, and anybody going in there is going in because they're responding to their ads that they're seeing online.
So I guess I'm just kind of curious. For instance, I was here at work and going to walk to lunch, and I ended up making a copy of a key, and there's a key making shop not too far from here. I didn't really know if it was key making shop. I've never been there before, but I just saw the sign and I went in. They made the key. They were a legitimate business. But if I needed to get some printing done and I walked into this business, they would turn me away then, and they'd say, "Sorry, we don't do that."
They would turn you away.
Okay, so, and I guess this just brings up another idea and opportunity for what may be, an actual unassuming customer that goes in for skincare, that goes in for printing, goes in for acupuncture, goes in for a haircut, whatever. And as you said, some of these reports come from those individuals. I want to see if there's a way that we can create a tool or an online reporting program, something that we can advertise that speaks to that, and maybe we put a little bit of advertising dollars to it. To your point about it takes a lot of effort to do the undercover ops, and with these businesses becoming more creative, right? We have to become creative and adapt as well. And so one of the things would be, and you pointed it out, that they still need to put some sort of sign and something that when somebody's walking around and they looked, it says, "Go to this thing," right? Until they maybe completely migrate over to the single-family homes or whatever they may be, which is another issue to get to. But this specific example that you showed the two businesses of, and you mentioned about barbershops and others, I would be curious on your thoughts, and if you could kind of go back and chew on that, and then maybe just respond back to my office and let us know what the opportunities may be to put something together for these unassuming customers that go in for printing, determine that that's not the case, and then somebody that just doesn't call 911, right? And they go away with it. But could we have some form of advertisement that says, that we market that, like we do with fireworks, like we do with other crimes that we want people to report, and we say, have you gone into, what may be, we could surround it around human trafficking, because that, I think, right, would grab a lot of people's attention to say, yes, I want to help in this regard, rather than just, I went into the print shop and I got turned away and I had a weird feeling, but then I just left it alone. But if we promote this and, help us end human trafficking, help us identify these businesses, have you gone into a salon and been, turned away for salon work or something like that. So I would like to just, I'm going to kick that over to you, and I'll ask that you report back to my office, within the next month or so, and just give me your feedback on that. And, if you wanted to share any thoughts today, you could. So
yeah, just very quickly, the way we do it now is we actually will bring in additional resources that will comb about 10 different escort websites, and these escort websites will list phone numbers. They won't list addresses. We will actually track down those phone numbers where they go to, and that's how we're able to kind of figure out where these places are. So a key component to any of these businesses is making money, and to make money they have to bring in customers, and to bring in customers they have to advertise. So the most effective way that we found to find these places and quickly deal with them, and we do deal with them very quickly once we identify them, is just simply to do that research have resources constantly looking at those websites, and when a new ad pops up with a phone number, to do the research on that phone number and track down where it's at, and find out if is it a motel, is it a residence, or is it a commercial business? Okay, so that is actually proven to be a very effective way to find these businesses, and that was really how we found so many more this year that had kind of popped up. It was actually through monitoring those escort websites as these businesses were trying to advertise.
Great. That actually sounds a lot more efficient than what I was describing. So, I spent a little bit of time, sharing opinions, but I actually do think that is you're looking in the right places and you're trying to identify these. We talked about this when we focused on the massage parlors. We talked about knowing that, businesses are going to get creative. They're going to start using other, terminology like salons. We never thought printing businesses, but right, you think of some of the logical ones. In that same vein, when reviewing the permits, I am curious then, and especially through like the LEAP program as well, are we still only, when somebody comes in to obtain a permit, I'm assuming somebody tries to obtain a permit for a print shop, if need be a business license or something they're paying for, that we're not running them through that system, right? You're not going to do that maybe for somebody opening a print shop. But are we doing it for barbershops and salons, or are we still only focusing on massage parlors?
Well, that's kind of the next phase of this project. So we're actually going to have to sit down with our own permits unit to make sure they're using LEAP and vetting these businesses through that system to see if there's any connections to other cities or open investigations.
And then to the point of what businesses will we actually be asking them to run through?
Well, typically it will be anybody applying for a massage business permit. I will say this, though. We do get, and this was something that we talked about last time we met, we do get a list from the finance department quarterly of all personal care businesses in the city, so we can kind of keep a revolving roster of all personal care businesses. And we were actually able to identify some illicit businesses off that list. So that's something that we get every quarter from them. It would just be a resource issue because there's so many businesses on that list. You would have to actually sit down and run every individual name in that system, whereas right now we're just focusing on the massage businesses.
Okay, yeah, I would like to see, especially, let's say for instance, we are able to resource Vice Unit better in the future, but this end of it is actually through permitting, right? So I would like to see that we're being a little bit more proactive on the front end with some of these other businesses as they're getting more creative, and we know they're already doing it, utilizing these other business titles, that we're proactive in researching that as well, because it could be as simple as what you were saying, running it through LEAP, and then determining, like this one individual that had 5 or 5 others, as you said, I think it was the print shop one, right, that was associated with 5 others, determining that, hey, they're trying to now open a barber shop or whatever it is, but now this is the same person we've dealt with. So I would like to try to be more proactive through our permitting. So maybe we can discuss that even a little more next year as we report back. You mentioned in regards to that person that had a number of businesses, they were charged with felony pandering. What is the outcome for that person? I mean, that I'm assuming we had shut down other businesses that they were associated with, and then ended up determining that they had now reopened or opened up this print shop. So what ended up happening with that felony pandering charge?
So Sergeant Galeo was very involved in that case, so I'm going to turn it over to him to talk about.
When we busted the printing place, I want to say it was like 4 or 5 months ago, and it takes a little bit of time to submit the report to the district attorney's office, and they actually file the charges. So currently it's still making its way through the court process, so it's not finished yet.
Best case scenario, what would be the time or the fine or the whatever that this person would be looking at?
Well, the state of California still has very strict pimping and pandering consequences. And so my guess would be, since this is her first time, she'll get like 5 years probation and a lot of specific strict conditions of probation, such as you can't operate a massage or personal care business, and you can't employ employees who are providing personal care services.
Okay, thank you, and maybe we can get an update on that next year too, just to kind of see some of the outcomes of some of these. Speaking of outcomes, and this is a question for Kimberly, in regards to the 19 potential survivors, I was curious, a couple questions. One, were any minors, or did we identify any, and this could be for yourself, Sergeant Galea, but so were there any minors, and then did anybody accept any further assistance, or did we get anybody kind of admitting to human trafficking, or what does that look like in regards to the opportunities there for your work?
So I know for a fact that there were no minors that we did come into contact with. I do know that some of the survivors did opt in to having follow-up calls, but I do not have a number for you of how many survivors did.
And any that we identified where we could actually put some human trafficking charges on some of the individuals, or no?
No.
No. Okay. So I think that's one area too, and that's where when we hear back again next year, because we know what's happening out there, right? I mean, we I think recognize that this is something that is occurring. Not 100% of these individuals are out there willfully engaging in this business. But if we're not making any headway in that regard, whether it's with these victims, getting them further resources, that doesn't necessarily mean every single time we need to make a case on someone for human trafficking. But I would like to hear, okay, well, we did end up having, X% of the individuals we contacted that did want further service or support, and that shows that this component is very useful, and why we would want to support that, because as you know, right, the city is able to, and along with the county, to support the work that your organizations do. And then additionally, it would be great if we actually, we could get some of these victims to feel comfortable enough to then we could make a case on someone out there for human trafficking, because again, we know what's happening. So I would like to hear continued updates from yourself in the future. And that's all my questions. So we don't have a motion, so if we could just get a motion, if we could include the... Motion to approve. Your mic's not, sorry.
Motion to approve, including a future annual report with all the updates that Councilmember Perales stated.
Second.
We have a motion and a second. All those in favor say aye.
Aye.
Motion passes. Thank you very much for the report, and we look forward to hearing from you next year. All right, and now we'll be moving on to item D2, our Fire Department Emergency Response Times Performance Semi-Annual Report.
Good evening, Chair. I'm Reggie Williams. I'm the Assistant Fire Marshal, and Assistant Fire Chief, and I'm joined here today with Michael Van Elgert, who is the Deputy Chief of Operations. And we're here to report the Fire Department Emergency Response Times Performance Semi-Annual Report.
Good afternoon, everyone. I first want to start with stating you should have a sense of accomplishment. And we're very appreciative of the work that was done over the last several years on this topic. As we provided to you in the memo, we have 18 months now of meeting the standard or exceeding the standard of 90% compliance. So that is fantastic, and that a lot of the praise and the cause started here, and then the fire chief's office became transparent with our times, and we were able to collect data and then come up with a work plan, and from that work plan really address what occurred. So we're just going to go back through some slides here and then talk about where we can move forward and to continue to strive to, quite honestly, every second does count, so we're shooting for 100%, right? And our goals are to get as close to that as we can. So the first slide, just to remind you, it goes through what we measure. And the city standard there includes the alarm processing time. And I do think it's important to identify that all of these components are still part of the overall delivery model, right? That we have to, after we respond, mitigate the event, and then go back into service and be ready for the next event. So while we tend to focus on response time, unit availability is also part of the overall measurement. So that's the city standard, which was, I believe, 80% of the time. And then the county standard measures from turnout time, travel time, et cetera. And that's where 18 straight months we have met or exceeded the standard. And so I just wanted to show you where we were. And then here are our numbers. This is where we started in July of 2017, when we had what we felt was clean data to provide accurate numbers with. And as you see there, we had some struggles there in the early part of, or the end of 2017. And then if you move on, this is the standard for all of the last fiscal year. And as I've said, it's extended into this year with 18 months over at 90%. I did note it when I went through this that both Februarys seemed to have a little bit of a drop-off. And we're still trying to figure out exactly why that was the case. It's not necessarily tied to call volume, but we are looking at that as an interesting sort of outlier. Both years there was a low in February. So this is a summary of that whole period of time, and it looks at both the City 1 priority and the City 2 priority for Code 3 and Code 2. And if you just follow the blue line across, you can see that there was a downswing there at the end of 2017, and then we have consistently met the 90% standard or above moving forward. And for the Code 2 responses, we've been consistently over 95%. And so again, each one of these events is a person asking for help. And so I think that's very important to remember, that the product is about providing the care that we took the oath to do. And then we tapped into this one here, which is the same presentation, but shows you sort of the call volume, trying to track if there is a tie-in between enhanced call volume and the performance levels. And in general, as you can see, the call volume's all over the map. We can certainly tie some of those instances to large-scale events and some other peaks. But in general, what we didn't see was a direct correlation between call volume and the response time number. So where now? What next? How do we continue to get better? And so one of the things we're going to look at here is, and then the next two slides will help us identify this, is a way to see if the changes we just recently implemented made a difference. And those that we just implemented are the measuring the impact of off-hook answering. So at the alarm receipt before dispatch time, it's forcing the call to be answered by the dispatchers. We'll see if that improves that alarm processing time before the dispatch. Another thing we're looking at is travel time and how we can affect that. And as you know, with the passage of Measure T, the station placement, where they are placed, is critical to helping us improve the travel time, the 4-minute travel time window. And a lot of effort went into looking at the heat map of where the calls were and where we project growth. And that was tied into when we made the presentation on where we suggested the stations would be, and it was accepted. And we do think that once Station 37 is in place and working, that we'll see an improvement across the board in 4-minute travel time in that area. And then finally, we would also want to look at the CEVP, the preemption system that has just come online, and to see if that improves travel time as well. We have some tentative initial positive return on that number, that we do think there is a saving in time, but certainly the other thing about that is that it is certainly a safer intersection to enter. And I think that's also very important to remember. Again, a vehicle that's out of service due to a crash can't respond to the emergency. So that's important. So I just wanted to show you a slide, and we're going to come back to this one, but what this summarizes is your work plan that we've worked on together, and to try to address the specific segments that can be improved, right? And so these are the ones that we have kind of ongoing. There were lots of them that were started in 2014 that we included in the memo that were completed and showed positive output. And again, 18 straight months of meeting the 90% or higher is a good standard, and we want to maintain that. And so some of the things that are on here is, again, we moved to force answer to improve call processing time. And so if you look at the segments there, right, travel time, alarm processing, turnout time, those are the areas that, and travel time, those are the areas that we would want to look at. So if you go to the next slide, what we've included here is really a summary of where we saw improvements. So the call volume there in blue shows you the way the call volume has, peaked and valleyed throughout the last 2 years. And if you look at the orange number, that is the alarm processing compliance time. And there's a slight uptake, and that's amazing work by our comm center that is understaffed and working very hard. But some of the changes made there with CAD-to-CAD improvements that we're still working towards, the forced answering and other areas there have a slight increase there, which is good. You'll see that the turnout time, the gray line, which is our crews getting out the door and responding to the call, has seen a significant upswing and has maintained a very high level. So the message was received, and our people are working very hard to make sure they're responding quickly. You remember, they do have to put on their PPE, their personal protective equipment, and be prepared to respond to the call. And then that line at the bottom there, the travel compliance, the 4-minute travel time circle, you notice that number tends to stay pretty low. And there are some factors to that, and traffic patterns, and time of day that the call comes in. And those areas is an area I think that we can continue to focus some energy and come up with some more strategies to address. So to go back, that's where I want us to focus here on the segments here. The ones that say travel time, again, is the areas I think we can see some significant improvements if we continue to work on these strategies and solutions to that area. And that will help us continue to enhance the overall number. So it's the deployment refinements there, the move-ups. We have implemented a more robust move-up policy using the information we received through the vehicle locators, and that allow us to see where units are. So our comm center is doing a more robust move-up policy. And then along with that, the backfill for training is a very significant and helpful component to improving travel time. By not having units out of service for training, we are backfilling those units with the agreed upon budget add that allows us to overstaff. And so we use augmented staffing to allow our units to train and still cover those areas. And that's a very important and significant part here. I can't emphasize how important training is, right? And we have to commit hours to it. We have a lot that we hold our crews responsible for to master. And so we have to provide training time opportunities without reducing the response time. And the secret to that is additional companies on duty that day to cover that area. It's made a significant difference. And then I'll also point you towards the areas that are still being worked on. The Omega policy, which is an alternate dispatch policy. We're looking at some other solutions there, including reducing 911 calls from high volume facilities. The first facility that's being used at is the main jail. It's a county-based, county EMS working with us in partnership to reduce the number of 911 calls at a facility that has an infirmary and a physician. And so that will help us with the number of calls in the system. And then we are still working at the CAD-to-CAD links, which we think will help us with alarm processing time. A closest unit dispatch, the ability to see the units in a CAD environment and then attach the closest unit is still in process. It is a lot of technological challenges there, but that will, I think, also help us with travel time. And then finally, we are still working on improving the station alerting system. Again, a lot of technical challenges there, and we're still in process of getting it up and running. We've had a few bugs we've had to work out to make sure that it's got 100% accuracy. So that's our presentation, and we're certainly here and open and willing to answer questions, but I think in general, in the memo, what we can show you is that the work plan that we created together has made a difference, and that the performance shows that. I think that we have targeted alarm processing very well and that there have been improvements there. Turnout times has significantly improved, and our challenge now is to work on how we can improve the 4-minute travel time component. So thank you very much. I very much appreciate being able to present this, and congratulations. And we're here to take questions.
Thank you. Congratulations go to you. Questions, comments from my colleagues? Councilmember Arenas.
Thank you. Absolutely, congratulations go to you and your team. I know that you call them PPEs. Is it
Personal protective equipment. I'm sorry.
Equipment, yeah.
Try to stay away from using the fire department slang. And, yes, so that, we have to wear the
Yeah.
appropriate personal protective equipment for the event.
No, I'm really proud that you're able to achieve this 18 months straight and get your gear on to remain safe. I don't know that any one of us can get out of the house if they timed us. And counted on if we were to, well, we're not saving anybody's lives for sure coming to work any day of the week. So I've got to say that this success is based on I think fundamentals, and it comes down to your staff and the training of your staff and your ongoing support to have your staff trained. These other measures to improve response times, we have to rely on technology, right? And I think that you talked about the preemptive system, and I wondered, you just said it just got launched. How long ago was that launched?
When you mean the preemptive system, are you
The
referring to?
preemptive traffic.
The vehicle preemption system.
The vehicle preemptive.
So fully operational, would we say 90 days?
Oh, is that right?
Sir?
So we were fully operational about 4 months ago, and we've gotten more than nearly 400 intersections that are completely operational, and so we're seeing
How many intersections?
over 400.
Over 400.
Yeah.
Wow.
And so we're seeing the pathways being opened up for emergency vehicles in order to get to emergencies much quicker.
Wonderful. And are those areas that, or those intersections, those 400 intersections, are those prioritized by the typical areas where there's a lot of calls for service? Is there any layering of that information? And here's where I'm thinking. So I live next door to the Villages, and that's a community for 55 and older. Many of the residents have been living there for a really long time, so I always hear EMS. Fortunately, we have a fire station just down the street, so that's life-saving for those folks. But I just wonder, for those 400 intersections, and if the Villages didn't have a fire station right next to it, and maybe some blocks below down on Yerba Buena, would maybe one of the intersections leading up to the Villages be prioritized if that was an area that always got calls for service? Are you prioritizing any of those 400 intersections that have come online so far with calls for service, or are they just coming online in another way?
So the intersections themselves are not prioritized. It's based on geographical location, so the intersections within the city of San Jose, as long as they are maintained by our DOT, all of those intersections are prioritized by the apparatus. So the first responding fire apparatus has the priority for those intersections. The intersections that we're still working with are the ones that are operated by the county.
Oh, got it. Oh, okay. So when I heard you say it was 400 intersections, I thought maybe there was some that weren't prioritized, but now you're clarifying. So we're going to work with them on like expressways or county roads that are not annexed into San Jose. Are they also working, do they also have this preemptive, tell me the name again. It's vehicle preemptive.
Yeah, we call it emergency vehicle preemption. And I want to stand corrected. There's more than 900 intersections, and we have had the system online since the end of 2018.
900. Okay, wonderful. Okay, wonderful. Thank you. That was one of my questions. I thought I heard it was a recent launch, and I wanted to know what was the protocol for that. Good Lord, I had another. Oh, you talked about the great work of the communication center for some of the stats being high, and it was on slide 10. We've heard, there's been some struggles with our dispatcher unit, but despite them being having some vacancies or overstretching some of their folks, they still are performing well. Tell me more about that.
So our communications center, which is also accredited, is still performing at a high level, and they're processing hundreds of calls per day. And yes, we are facing some struggles with retention. However, we are working with our recruitment and trying to bring those numbers up. What we do now, as far as maintaining and staffing our communication center, is we have recently changed their schedules, which has made it more attractable for people who want to become fire dispatchers. And we've also filled some of the vacancies with overtime. And a lot of these things came out in the 311, 911 audit, and so we are responding to some of those things.
And how recent was the schedule changing?
The schedule has been changed since the end of August. Yeah, very recent.
Oh, okay. Anything else you want to add about that work that that the communication center, or how they contributed to the work on? I think you had mentioned earlier on slide 10.
Yes, I'd like to add that we just recently implemented the force answer component, which means that shortly after the call comes in, if it's not picked up, a light goes off reminding people to answer it, and then they basically have to answer it. In a nutshell, it's a forced answer system. Again, that type of system allows us to get the call started quicker, but it is putting an added burden on the dispatchers who are running all of the other events at the same time. So it's a challenge that we're looking at, but there have been studies that show that you can save seconds there by having the phone answer. And it does address that feeling occasionally where someone feels like they called 911 and there's no answer. So.
Got it. And when did you say the forced answer component system got implemented?
That's fairly recent as well.
So the force answer system will actually go live at the end of this month. Our dispatchers have gone through training, and we had some technology implications, so we had to put in some hardware and also provide some training with the dispatchers so that when the force answer goes live, we have some safe measures.
Say that again.
I'm sorry, the light system, the lighting showing that the call was coming in is active, but the whole system was not in place till the end of the month. My apologies.
But still, that still gives a kind of a visual signal for that dispatcher to get to that other call. It still serves the same purpose. It's just not a formal lift of the whole system, right? Okay. Well, my ears kind of perked around just all the great work overall, but every piece of the puzzle here has to work together to get this success. And so I'm glad that there's a lot of the recommendations that were made during some of the audits are being enacted now, that we're starting to see some of the benefits of it. But even before the audit recommendations, I think that there were some improvements internally anyhow, right? So I want to just congratulate you on all the great work that you're doing and that you've done for our residents. I don't know if either of you were in the room when there was a resident who came in and just talked about a very just a horrible experience with her daughter and having her not being able to connect and get through and have medical care. Then she thought back to, she knows somebody who's in the dispatch system, and so that's the way she was able to actually get some care. I don't think that we'll hear many of those stories because it sounds like all the systems that you rely on are getting improved every day, and we're going to have this launch off at the end of the month for the actual hardware, although the systems, some of the visual systems are already in place. So I want to thank you on behalf of all of our residents for the good work that you do for saving lives, because you really, truly do. And congratulations. Thank you.
Yep. Vice Mayor Jones.
Yes, I want to say also thank you for the report. Just a couple of quick questions. One is, I know that ongoing discussion about meeting the 90% threshold in order to receive county funding. Can you quantify what the difference has been in terms of being able to meet that 90% threshold in terms of the amount of funding additional funding that we receive from the county?
Yes, to clarify that, the 90%, we are not penalized in totality, but 95% is when you get 100% of the funding returned. Okay. And so it is call by call, and there is a system that the county is using to review the events, as well as that we're using to count each single instance and look at. And it basically is a sliding scale on how the penalties are depending on how late a vehicle is. But I think I can get you the numbers here in a second. But I think that as we move closer to 95%, once we hit the 95% mark, that's 100% return on any of those penalties. So that's it's a fiscal reason, but the more important reason, it's better patient care.
Right, definitely. And I don't want you to do the additional work. I just thought you might have a rough number off the top of your head. Especially my understanding is that if we didn't hit the 90%, we didn't get any compensation, right?
That's correct. Yeah.
So the fact that we are on the majority of the calls going over 90% is definitely a positive thing, financially at least.
For 18 straight months.
For 18 straight months. And the other question I had too was, if you look at your chart on page 4, where we had, and if you look at March 2018, you can see where we were under the 90% threshold and under 70, well, at 70.88 on the priority 1 calls. What happened, or can you identify a specific factor that caused us to go over the 90% the following month and stay over the 90%? 'Cause it seems like something happened in that month.
So if you look through, I'll let the chief come down, but if you look through that was still part of the implementation of some of the work plan, but I'll let him comment.
Hi, Chief.
Good afternoon, Robert Sapien, Fire Chief. Councilman, thank you for the question. Vice Mayor, excuse me, thank you for the question. So I think what really moved the needle in that time period and has kept us above the 90 mark since March was we had really gotten to a place where we overcame the turnout time challenge. And so, as I've explained, I know it's been quite a while, but prior to, I think it was 2014 when I got here, we were doing something that was called pre-alerting. And so the pre-alert system would notify a station that they were about to get a response, and we asked companies to actually wait to respond until they got a fully notified dispatch. That was built upon a prior theory that we could right-size the resource for the call. So the whole medical priority dispatch system would take a 911 call, would hear the circumstances of the call, and we would decide what kind of resource would go and what code of response, so code 2, code 3. Great in theory, except we only have one type of resource, right? So we don't have a large number of networks to decide we'll send a 2-person unit or a 4-person unit or a truck or an engine. We just don't have enough resources to do that. So while it was a good thought in theory, it's far too costly to actually put into place. In the meantime, though, we trained the entire workforce to not respond when the bell rang, right? So that point in time in March is where we undid all of that training and got us back to a place where we were doing something called early dispatch, meaning we send the call to the station as soon as we know an address and the general nature of the call before we do medical triage. And so it was at that point in time where I think we're really driving home the message that we're not doing pre-alerts anymore. We're responding immediately upon the strike of the bell, and that's where I think we really got it as an organization.
Great. Thank you. Thank you, Chief.
Councilmember Jones, Jennifer McGuire over here. In answer to the question I've got for Chief Van Elgort, we are budgeted for $2.4 million on the paramedic program this year for reimbursement from the county. We got 2.2 approximately last year. I'm sure we're going to exceed the 2.4 given the history that's been going on meeting the times.
Great. Thank you.
All right, thank you. Appreciate the report here and certainly all the successes that we've been having. And, you know, the response time at the end of the day, certainly we're talking about the motivation, right, that we have in getting these resources. But we've said it before, so I won't let it go without saying that, you know, the response time that we get to is the real benefit is to the community members out there, right, getting to them in a timely manner. And as we know, minutes and seconds could mean a life. And so I think this is something definitely to be proud of and continue to aspire, as we've seen on this list of 24 different action items that we can still continue to, well, a number of them actually completed, but the remainder of those that we can continue to see some improvements on. In that regard, number 20 in your report, it states, strategies initially included a reduced number of resources unavailable due to training and decentralized training to reduce travel time to and from training. And it says, while both strategies produced greater resource availability, resulting compromises in training practices were too great to sustain. And then it mentions the department continues to deploy backfill resources to cover staffing gaps created when companies are out of service for training, and then enabled by 2016 budget action. So just kind of curious, what were those resulting compromises in training practices that were too great to sustain?
The solution was the enhanced budget staffing that allowed us to backfill companies and put them in so that we could send the companies to training at a centralized location. With decentralized training, there are a lot of challenges, as I'm sure you remember. You have to have everybody, the whole cadre of instructors trained to the same level. They have to all be experts as trained to trainers. And then even if you went to a battalion level and you did the training at the battalion houses, there are still companies to pull in out of service from the outlying areas. And so if you're talking about true decentralized training, that's actually at the individual stations. So that's a lot of resources that we don't have to be able to have, say, 40 different train-to-trainer level trainers. And then when the training's happening, are they in service or not? And if they're in service, then and they get interrupted, is that quality training? And the answer is no. And so that was really the challenges with decentralized training was, one, were we providing the same level of training, and were we getting a benefit of actually having rigs in service? And I think we found that we went back to the prior model of doing more centralized training, high quality training, and then using the budget ad to backfill those stations and maintain response times. And from my personal experience, I think that solution is the better one.
Okay, and then from our city manager's office, Jennifer, is that funding sustained, or is that something That is now, yeah.
Yes, that was put ongoing into the budget, so we could do that. And it was also the time that we also, stopped the browning outs and things like that. So there were several budget actions the council approved a couple years ago.
Okay, and so that will now allow the fire department to continue this training method. Great. And then lastly, I know this is a semi-annual report. How much longer is this a semi-annual report?
It's up to the committee's pleasure. We can go to an annual report if that would be something, since they've made so much progress on their work plan, if that's something you'd like to do for the next time.
I am comfortable with that. That was going to be my ask to my colleagues. Unless there's an objection from the fire department, if you're eager to come back and report this twice a year.
I don't think I do, but I would say that we're going to continue to apply the same practices we do every day and make sure that we're doing the correct work and collecting the correct data regardless of when we report.
Okay, so I'm comfortable with an annual report if we want to move this to that, and I'll ask my colleagues if you want to make a motion to accept this and then move it to an annual report. We have a motion from Councilman Arenas. Second from Vice Mayor Jones. All those in favor say aye. Aye. Aye, motion passes. Thank you very much. We'll see you in a year. Thank you. Oh, please.
I apologize. I have one more question I completely forgot to ask you, but that was part of, I think in one of your later slides, you talked about the county having the jails being one of the areas that has a lot of calls for service and restructuring that system. What is the change? When is that change going to be? Because it makes sense that you wouldn't respond to the jail since they have an on-site doctor and crew there, right?
Thank you. I'm going to answer personally because I've been driving this part of our work plan. So if you recall, we have an outstanding audit recommendation that talks about expanding the use of the Omega protocol, which is the lowest level medical priority dispatch level, meaning we wouldn't even send a resource to that type of call. Mm-hmm. The challenge there is it's really hard to triage calls down to that particular level where we could say that the patient is okay by virtue of questions on the phone. Since I've hit a little bit of a wall on making progress on the Omega protocol, I've shifted to analyzing our busiest addresses for EMS responses, and we're trying to see if we can work with county emergency medical services to find alternate solutions for calls that we know are often low-level calls at facilities that have medical staff on hand that are currently using the practice of calling 911 when someone needs to go to the hospital. And so the jail came back to us as one of our top 3 facilities, and so we're working with county to come up with solutions to send the appropriate resource and stay out of the 911 system where we can.
So that work is getting done now. So you project like maybe the next time you come and provide a update that there'll be a good report there?
I think so. So the jail, for example, the medical director, Dr. Miller, with county EMS, has worked with the jail to install a hard phone line that can give them access to inter-facility transport rather than calling 911. And so it's early. We don't have all the data in, but yeah, I do believe we're going to be able to report some level of progress there and hopefully at the other addresses that we're targeting as well.
Great, great. That makes so much sense, and thank you so much for continuing to move on that. That hopefully take us to the 95% eventually, but thank you.
Thank you.
All right, thank you. That's it, gentlemen. We will now move on to item D3, our Park Ranger Program Annual Report.
Good afternoon. My name is Justin Long. I'm the Deputy Director for PRNS for Parks. I'm joined to my right by John Cicerelli, the Director of PRNS, as well as Pam Helke, the Supervising Park Ranger. We're here today to present the annual report for the Park Ranger program and to go over its highlights, including volunteer activity, as well as the 2019-2020 work plan. All right, the City of San Jose's Park Ranger program is an integral part of the Department of Parks, Recreation, and Neighborhood Services. The program's mission is to provide a safe, enjoyable park experience by protecting and educating the public, providing recreational opportunities, and protecting, preserving, and enhancing the natural and cultural resources of the city's parks, trails, and open spaces. Over the course of the program's 47-year history, San Jose Park Rangers have worked to ensure a safe and enjoyable atmosphere in city parks. Park Rangers assist park users providing information on appropriate park use, educating park visitors on park rules and procedures, and as peace officers, Park Rangers also render emergency medical care and conduct search and rescue operations and perform wildfire prevention patrols, as well as provide initial wildfire suppression. And as stewards of the city's natural and cultural resources, Park Rangers work to protect and monitor parklands, restore native vegetation, maintain rustic hiking trails, as well as educate the public on the cultural and natural history of San Jose. The Park Rangers also maintain safety and security in our neighborhood parks and along trails. In December of 2018, the department submitted a Park Ranger program status report to the Public Safety Committee. And in this report, the department listed the following steps for the Park Ranger program during the 18-19 year. The first was the police department and PRNS review joint patrol costs so the administration may consider potential recommendations to bring forward in the 2019-2020 budget process in light of the city's overall fiscal condition and other citywide priorities. Finalize the Ranger Duty Manual. Continue to work with regional partners to improve recruitment and training options for Rangers, including exploring the creation of a local Ranger Academy. And 4, explore the operations around implementation of body-worn cameras and related training for Rangers. So additionally, in January of 2019, the mayor and city council heard this item, which the mayor also recommended exploring scheduling joint patrols on Saturdays and the option of having this become an assignment for police officers rather than through secondary employment unit. The program has confronted many hurdles over this past year, but still produces quality results and key highlights. That Pam's going to lead you through the year's program highlights.
This year, the San Jose Park Rangers became the first in Santa Clara County to implement a program for intranasal naloxone. We were the recipient of a grant from the Santa Clara County Emergency Medical Services Agency. Effective about 2 weeks ago, we now have intranasal naloxone for the treatment of opiate overdoses on all of our emergency vehicles, and every ranger has been trained to use that life-saving drug. We also have met our goal of all peace officer park rangers have completed the post-implicit biased and principled policing training, and we are on track for all of our peace officer park rangers to have completed the 40-hour crisis intervention training. We have 3 recruits in the academy right now, and they are scheduled into the first available CIT class as soon as they graduate. So they'll be in February with their graduation date of mid-January. The department has been working on joint patrols for the riparian corridor areas. Of the 111 possible patrol dates, beginning in mid-September of 2015, we had 51 dates that were filled. 40 were not filled due to the lack of availability of either the police officers or the park rangers, and we had 20 dates that were canceled for other reasons, primarily the weather. One of the biggest problems we're still struggling with is maintaining citywide coverage of our regional parks and open spaces due to our staffing shortages right now. So that sort of limits the amount of time we can dedicate to the joint patrols on the creeks, and which is also why we've not been able to get to the Saturday patrols yet.
So A lot of the discussion that happened from the spring and winter of last in 2018 and in early spring of 2019 had to do with looking at how the park ranger program was operating and addressing some of the concerns that the rangers raised. And what the department had done since January of 2019 is we've held a series of facilitated discussions talking about daily duties assignments to identify areas of focus and to improve the overall program. The meetings were facilitated in partnership with the West Valley College Park Management Department, as well as the executive team in PRNS. Those meetings resulted in a variety of topics that included training, risk, safety, equipment, staffing, standard operating procedures, joint patrol, best practices, and more. The working group currently has formed multiple committees to research and present solutions to address each area identified through the facilitation process. PRNS expects this process to continue through the fall and winter of 2019 and make recommendations for the department to implement in early 2020.
Recruitment and staff retention is still a challenge for the department. We have made some progress this year. Of our 23.59 full-time equivalent positions, if you can see in the chart, we've gained a few. We currently have 3 rangers in the academy with a projected graduation date of January 15th, where they'll move to field training. We have 1 lateral hire that we got from Sonoma County Parks, who successfully completed her field training program and is now in independent patrol. And we have 1 candidate that is currently in conditional job offer. He's completed his medical and psychological screenings. We hope to get the results back next week and be able to bring him on board by early November. Let's see, we've had a few retirements and a few other transitions, but overall we've still been able to reduce the number of vacancies this year. The Rangers continue to focus on public safety as part of their initial response. Rangers are still the first responders to any emergency that happens in their assigned area, and that can include medical emergencies, search and rescue events, and wildland fires. All Rangers are cross-trained as emergency medical responders. They're certified in wildland fire suppression and take training in conducting search and rescue events in our open spaces. As you look through the numbers, it kind of looks like 18, 19 are a little lower. Some of that is just a cyclic change. We can't predict when people are going to get lost or hurt. But the other issue is we're transitioning our data keeping from calendar year to fiscal year. So 2019 was not complete in that. So we'll have updated numbers as we close out the year. Enforcement stats. Park rangers, the peace officer park rangers patrol parks and enforce applicable state and local laws. And our department philosophy is to use the lowest applicable level of enforcement for violations. With that, 95% of all of our law enforcement contacts are generally closed out with either a warning or education on the violation. But rangers are still actively issuing criminal citations, conducting investigations, and making arrests when necessary. Our program also continues to try and be as active as we can with our community volunteers. We are committed to leveraging our volunteer resources and continue to work closely with our community groups and other educational institutions to make park and resource improvements within our parks and open space. If you look at our current numbers, again, some of the decrease is because of the change in the data keeping. The other is that with our staffing shortage, we have not been able to dedicate the amount of ranger resources we want to support some of our volunteer groups. So we don't lose that momentum and lose that effort. The Rangers have been coordinating very closely with the department's volunteer management unit. If the Ranger can't support the volunteer group, rather than turn them away, we work with the VMU to make sure we capture that community enthusiasm and get the projects done. So that should reflect in an uptick in the VMU statistics. We have been able to continue our interpretive programming. I was able to convince one of our Rangers who retired last year to come back as a retiree rehire and focus on coordinating our interpretive programming. This summer, we were able to offer 14 programs, which included guided walks, stargazing, movie nights, and some campfires. We also were able to build on last summer's overnight camping event. We offered 2 sessions of Learn to Camp this year with the strong support of the Bay Area Wilderness Training. We did one at Alum Rock and one at Kelly Park. Both were highly successful, sold out almost immediately, and had very positive results. We were also able to coordinate a meteor viewing party with the San Jose Astronomical Association. We had over 120 guests come out to join us for stargazing and meteor watching. And we had a glow-in-the-dark disc golf event with Silicon Valley Disc Golf. So we've been getting a lot of good community support. Rangers also partnered with Happy Hollow Park and Zoo, where on-duty rangers would attend some of their zoo camps and provide some interpretive programming. So overall, we completed 26 programs this season with 1,307 participants, up from 14 programs and 950.
So as the department continues to have a very successful ranger program, we do have some challenges. And to address those, recruitment and retention of park rangers still stays as our #1 topic and goal. We're also in development with trying to develop a park ranger apprenticeship program in cooperation with the State of California Apprenticeship Program and West Valley College as to be a means of intake into the program. We're also working to develop a West Valley Academy so that our ranger recruits could be trained here locally through the local university. Also, it is impacted by our current staffing levels, as is providing the scheduled joint patrols. And as we get these next rangers out of our academy and into field training, we believe we'll be able to offer those at a higher rate than we currently have been. The department has been working, again, to meet some of the previous direction we were given from the Public Safety and Finance Committee. This past budget year in 2019-2020, we were able to secure funding for the joint patrols. We're working to finalize the Ranger Duty Manual in the next several months, and we're also working to improve that training and recruitment process. That's in progress, and hopefully we'll have some direction in the spring from our partners at West Valley. Also, we're in the process of implementing the body-worn cameras and related training for the rangers in that process, and we hope to have that in place this spring. Again, as you can see, our main focus for the work plan will really try to get the apprentice program up, as well as the duty manual, the body cameras, and our joint patrols. So with that, we'll open it to questions to the committee members.
All right. Thank you very much. Questions or comments from my colleagues? Yes, Vice Mayor Jones.
Thank you, and thank you for that report. I just want to get a better feel for the concern that was raised about ranger safety, and the solution to that was to have the joint patrols. Has the feedback you've gotten from the rangers been positive or neutral, or what's the consensus in that strategy?
So I'll let Pam address the direct responses, but in general, the joint patrols have gone relatively well with the officers, with the ones that have been covered. I do believe that in some instances, some rangers don't feel as completely comfortable still doing that, but I do believe that we're doing the best we can to provide that safety and support through those joint patrols.
Overall, we're beginning to see the same officers sign up for the detail. So the Rangers were developing a cohesive work unit with the police department. So it's the same people. You develop a relationship. You develop a trust and an understanding. So I think that was coming along rather nicely. There's still Rangers who just don't feel comfortable doing it. There's a feeling that putting your safety in someone else's hands makes them uncomfortable. So, but overall, I think it's a program that can work, especially as the Rangers and the police officers develop their rapport together and their communication abilities.
Can you go back and, you said that there's at least for some of the Rangers, they're not comfortable putting their safety in the hands others? I'm trying to understand what that means.
That's the best way they describe it to me, is that when they go out into the creeks, if something were to go wrong, that they have to rely 100% on the police officers to defend them, and that's not something they're comfortable with. They would still prefer to be fully equipped to defend themselves. So again, it's a personal thought. It's not the majority, but there are a few out there that still have those feelings.
Vice Mayor, if I can just add, the park rangers do have safety equipment on them, or they do have an ability to take some defensive actions, and they are certainly trained to take defensive actions, but certainly the use of deadly force is not a tool that they have. And I think that's what Pam may be referring to with the officers, is they would prefer to have control of that themselves. But they're not completely without training or equipment to take some defensive action on their own.
Okay, great. Next question is on the memo, page 5, table 2, where you have the budget FTEs, filled FTEs, and vacant FTEs. And when you had your the row for the part-time rangers, you had 3.34, where you didn't have an offset in terms of filled FTEs, so it really skews the ratio of budget FTEs to filled FTEs. So my question is, if I look at this, your actual vacant FTEs are more than 5.75, unless you're not accounting for the part-time FTEs. If you see that.
You know, the 23.59 is the total budget, so 3.34 is part of that. If you look at the next column over, it says 13 part-time unbenefited park rangers accounted for 7,168 hours. That's against the 3.34, which is 6,947. So we actually got a couple hundred more hours out of them, likely from vacancy savings, out of that 3.34. So that 3.34 was worked FTEs.
Right, so it's actually filled. So
It's filled, yeah.
So the chart should actually be adjusted to reflect that, because your totals are off.
Yeah, so when you look at, look at the totals, and you got 14.50, right? And that's full-time filled officers, right?
Mm-hmm.
And then you have vacant 5.75. Go one more column over to your right, and it's filled plus vacant is 20.25 FTE. That's not including those part-timers. The part-timers we generally can fill. We can get those hours. It's the full-time rangers where we struggle. So there is still a vacancy of 5.75 part-time full-time and or full-time or part-time benefited rangers.
Okay.
Am I making sense?
I'm trying to catch up with you on that one. I'm looking at the farthest column.
Mm-hmm.
But let me give you a little bit of context. One of the reasons why I focused in on those vacant positions is, as you know, John, I've been driving you crazy about the one vacant position for the neighborhood parks position, and before you, I drove Angel crazy about that that vacant position. So I have one request, and that is that, when we generate the next update on the report, I would like to see that neighborhood position at least highlighted in the report, because it's still a budgeted position, and I want to see it represented in the report.
Okay, like in a table like this, as whether it's filled or vacant, or just somewhere talk about what progress
talking about
has or hasn't been made.
Exactly.
Okay.
And then the second piece of that is the strategy in terms of, is that going to be the last vacant position
Right.
that's filled, or is there another strategy to fill that?
Okay, sure.
I would appreciate that.
No problem.
All right, thank you.
Councilmember Arenas?
Thank you. I'm going to ask a question about what Vice Mayor asked about, and that's the partnership that happens with the police department. I know that you said that the police department or the police officers are the ones who sign up, and then the park ranger meets up or is able to connect with them and create maybe some level of relationship, as long as maybe it's the same police officer, and there makes a lot of sense, right, to have the same police officer and build that relationship. Is there, on the end of the park rangers, an opportunity for that to also be an elected assignment? Because it sounds like, and I'm not going to pretend to understand. If I was partnered up with the police department, I would feel the safest, right, with a police officer. Obviously, I don't have the type of training that a park ranger has, so I'm at a complete disadvantage. So I don't know if the partnership will be fruitful in the end if both sides don't see the benefit to it. Now, don't know that I heard that there was I heard maybe that there is maybe some officers don't see it the same way. They prefer to take on their safety themselves. And so, one, I guess I'm wondering what percentage of those park rangers is that? How many folks? I know I don't need names. I just want to know, is that in general, or is that just maybe the exception? Because if this partnering isn't, if we're doing this partnering, it's in good faith to create these partnerships or these relationships. But if one side isn't agreeing with that I'm not sure how far it can go.
I would say it's a minority number of the office. You gotta remember, we don't have very many rangers to start with, so.
Sure.
You're talking 1 or 2 people. I think most of the rangers have adapted to it. The rangers do volunteer for the assignment. Right now, again, we are focusing on just getting our parks covered. Today, I have 2 full-time sworn rangers for the entire city and a handful of non-sworn seasonal rangers. So it's the overtime assignments they're picking are just to get the parks open and closed and meet our needs there. So we do have people signing up when they can. If nobody's on vacation, if all the ducks line up, then we get a couple of extra hours. So, but yeah, it's like I said, it's a process that's coming. You're down in the creek. You kind of have to have communication, trust, understanding of each other's strengths and weaknesses. So, it's coming along. It's building. The officers that we get are interested in working with us and helping. So it's and they're actually starting to get interested in environmental crimes and things like that. So it's
good.
Kind of a win-win when it works.
Wonderful.
So when they have officers to send and we have rangers to send.
Wonderful. Then I'm glad to hear that maybe this is the minority of the rangers. It's not the prevalent feeling about this partnership. And I've got to thank you for the work that you all do within all of our parks. I have Lake Cunningham within our district, and that is just a handful in of itself, right? I mean, and we have a lot more parks other than Lake Cunningham, but that's a lot of work, right? And you got multiple entrances, and just a lot of folks coming in for different reasons, either for the lake or for the wonderful bike park that we have there, or for the skate park, or for Raging Waters. I mean, there's just so many different types of audiences that are coming in. There's, teens, there's little kiddos for the playground, and our park rangers continue to keep us safe there. Definitely a witness and grateful to the work that they're doing. We had our Fall Family Festival a couple of weeks ago, and I know that everybody is tied up with a lot of work, and they did an extremely great job in helping us and assisting us in that festival. But not only that, just one day, it's every day. Fortunately, our parks continue to be a safe place for families to go to, a free and beautiful place for our families to go to, and that's ultimately the result of our park rangers, and of course now with this partnership with our police department, but mainly it's the park rangers that we see there, so thank you.
Thank you. Just a couple questions here. So the first comment in regards to the chart at table 2 on page 5. I will say that the way that your totals line adds up with the description over on the right that kind of shows the filled plus vacant is actually 20.25, but yet the total on the budgeted includes the 3.34 equivalent hours for part-timers, and just denoting it over on the right doesn't make it as clear as it could be. So I would say to help clarify that for your next report next year, that you just find another way to organize that in the chart, so then that way it's a little more clear what we're comparing there. And then to the vice mayor's point, a little description of some of these, like he's interested in the neighborhood park ranger, describing what may be under some of these, in that it's not just a park ranger that may be a vacant spot, but it's a specific park ranger. So, and then actually on the report on page 4, you talk about the park ranger duty manual created in the 80s or in 1980 and last updated in the mid-90s. Is that correct to believe that there's been no additions since the 90s? So like that the last update being the 90s means that's it? We're looking at a document that was approved in the 90s?
The approved manual, the last one was in the 90s. It's been consistently updated, but we're in the final steps with having added everything into the manual of getting the final one adopted. But as things have come up, it has been adopted and put into the manual.
Now you've confused me more. So it has been updated since the mid-90s.
Well, I'll let Pam clarify this one.
The original Ranger manual, from when I started, was last comprehensively updated in the late 1990s. So for the last several years, we have entered into an agreement with Lexipol and are developing completely from scratch a brand new, comprehensive, up-to-date, modern park ranger manual.
But that's in the works, is what you're describing.
Yeah, the old manual has had some updates to it and some changes, but I wouldn't call it a comprehensive manual. So in light of modern practices. So the new manual is at the city attorney's office for final review. So we're hoping to, once it gets through there, we should be able to roll out a little more expeditiously.
What's the time frame that we're expecting that to be adopted, and is that something that comes to the council or this committee?
I'm trying to remember. Did it go?
I don't believe we were planning to, and I'm not sure that duty manuals are typically something we bring through council. That's more of an administrative action. But certainly if you wanted to see it or look at it, it would be available to you to look at.
What's the timeline?
And the timeline is in the next 6 weeks.
Within the next 6 weeks.
We should get it back from the attorney's office.
Okay, great. Yeah, no, I'm not necessarily suggesting it come here. I'm just curious if that's something that does. Sounds like it doesn't. So, and I wouldn't request that. So, I would like to see it though. So as it's in its adoption form, I'd love to take a look at it. So if somebody can get over a copy, or maybe even John in one of our checkups next month or something like that. So thank you. That's it. Any other questions or comments from my colleagues? If not, we can get a motion to approve the report.
Motion to approve?
Second.
We have a motion and a second. All those in favor say aye. Aye. Motion passes. Thank you. All right, and we're on to our final report here, which is item D4, the Workers' Compensation Program Semi-Annual Report.
Good afternoon, Jennifer Shembry, Director of Human Resources and Employee Relations. We are here to present the Workers' Compensation Program Update Semi-Annual Report, and I'm going to very happily turn this over to Eric Fortes, the Division Manager over Workers' Comp Health and Safety.
Thank you, Jennifer. Good afternoon, council members, staff members. Thank you for the opportunity to be able to present to you the Workers' Comp Program Update for the Semi-Annual Report. Our recommendation is that you accept the semi-annual report on the city's efforts to contain workers' compensation costs and reduce claims for the workers' compensation program. by focusing on wellness, health, and safety through the end of 2018-2019. For background, on June 18, 2019, the City Council authorized the City Manager to negotiate and execute an agreement with Intercare to provide comprehensive workers' comp services. This was a 3-year agreement starting on July 1st, 2019 and ending on June 30th, 2022. The total compensation for the agreement shall not exceed $15,963,931, and that's based on an estimated caseload of 2,330 to 2,850 claims. This next slide reflects the total number of open claims as of June 30th, 2019. As you can see in the far right-hand column, there are a total of 1,471 or 1,471 indemnity claims. Those are lost time cases. 108 medical-only cases and 1,068 future medical claims. When you compare that number to a year ago, on June 30th, 2018, we had 3,120 claims. So we've seen a year-over-year reduction of 15%. The next slide reflects workers' comp total claims costs. I'm pleased to report that we demonstrated a over $2.65 million reduction against budget and an actual over $3 million reduction against total actual expenditures in 2018-2019. Some significant reductions were shown in fire. There was over a $477,000 reduction there. Police also showed an over $200,000 reduction. PRNS demonstrated a $326,727 reduction. DOT was over $187,000, and Public Works was over $288,000. So an excellent job by all of those departments. This next slide reflects the Intercare staffing as of June 30th, 2019. For the 2,647 open claims that we have with Intercare, we have a total of 21 members on that staff at Intercare, comprises of 11 senior claims adjusters, 4 future medical-only examiners, and 6 support staff. What's interesting to point out here is that the senior claims examiner's caseload is at 133.7 cases. The industry averages ranges between 150 to 175. So this lower caseload allows them to be more effective on our cases. This next slide reflects the performance measures for Intercare that we monitor. There's what's called an adjuster technical audit summary, and that summary is composed of 4 different areas under quality and 4 under the state performance. And as you can see, their overall audit score was at 93%, which is excellent. In all of the areas that were measured, they came in over 90%. There were 3 new initiatives rolled out this past year, and there's a description of each one in your memo, but I'd like to point out the Interconnect program. This is a new program that basically connects injured workers with Intercare staff, specifically a claims supervisor and an adjuster will come on site to the city of San Jose, and appointments are made with injured workers so that they can meet face-to-face, in essence, connect with their claims adjuster and supervisor and have that interaction where they can have questions answered concerning their workers' comp claim, paperwork that's sent to them that they don't understand. They can sit down with their adjuster and be able to review that and understand that. This has been very effective. It was rolled out in fire in July of 2019 with police in September and the airport in October. It was so successful in fire that they've asked for another meeting, and we have scheduled that for next month in November for them to come back. On the Wellness, Health, and Safety Initiative side, there were a number of initiatives that were rolled out, a scoreboard, health and safety values, more robust action investigation program, reinstating quarterly citywide safety committees, continuing to develop policies from a compliance standpoint. We had the Health and Wellness Fair in July. a public safety wellness committee, a joint committee between management and the police and fire union to look at continuous improvement opportunities around wellness, post-traumatic stress disorder, cancer prevention, some of the topics we discussed there. An RFP in ergonomics that was completed, more employee wellness screening by our Employee Health Services Department that has, on a quarterly basis, goes to different departments. All of those are spelled out in the memo that you have. The one that I do want to point out is the Firefighter Fast Lane. And this is a pilot program that we launched in September of 2019. It's a joint management and union. We deem it fast lane because it's intended to streamline diagnostic testing and surgeries for firefighters so that they bypass the very cumbersome and delay process in workers' comp where a doctor has to complete a request for authorization and then it goes to utilization review for a review by a panel of doctors before that diagnostic test or that surgery can be completed. And so in essence, we've partnered with Kaiser throughout the state to pre-approve them to immediately conduct those diagnostic studies. And if it's positive, that they have approval to go ahead and move forward with the surgery. We feel that this is going to help with the recovery time for the firefighter, get them back to work, get them the treatment they need, and ultimately have a very positive experience when they get injured. Again, it's a one-year pilot program, and we continue to evaluate that on a monthly basis. This next slide are the health and safety values that we developed and rolled out in July. We communicated this citywide. It's on every bulletin board throughout each department. It speaks to the values and the importance of health and safety, and we wanted to just let employees know that the City of San Jose is committed to providing a health and safety working environment for them. It says here real briefly, mission first, safety always. The city cares about your safety and ensuring your health and safety is our top priority. A safe work environment requires teamwork and is everyone's responsibility. We address workplace injuries with an employee focus that fosters compassion and empathy. All workplace injuries are reported. Care is swift, and the city evaluates each incident to continuously improve upon our safety. Return to work is our goal for you and essential to employee recovery, health, and wellness. This is distributed during all new employee orientation, so on day one, they understand the value of health and safety and our partnership with them and our commitment to providing a health and safety work environment. In conclusion, outsourcing to InterCare has allowed staff to increase focus on safety and injury prevention, as well as manage the activities and performance of the TPA, the third-party administrator. The open claim inventory has been reduced by approximately 15%. Costs associated with workers' comp claims have been reduced by approximately 12%, as evidenced by the $2.65 million reduction against budget. Wellness and safety initiatives are anticipated to further reduce the number of injuries and associated costs. And with that, I'll open it up to any questions. Thank you.
Okay, thank you. Nothing from my colleagues, then I will have a couple. Thank you for the presentation. If you go to slide 7. I'm curious in regards to these performance metrics, what the goals or requirements are. I see on the quality performance, there's pass, fail, it says, but it doesn't say what denotes a pass and a fail. And sort of, so I'm curious what we're trying to achieve. And then with the state compliance performance, that doesn't have a pass-fail denotation, so what is the mark we're looking for?
Yeah, good question. So from the quality standpoint, these are best practices in workers' comp. The 3-point contact, the pass and fail is whether or not they achieve that. Did they contact the employer? Did they contact the employee? Did they contact the doctor within 3 days? A causation analysis.
I get what you mean. So the pass-fail is not achieve a certain percentage, you pass-fail. It's either you did it or you didn't.
Correct.
Got it. And so is there, though, a percentage that we're attempting to achieve in these quality performances, and is there a percentage that the state is attempting to achieve in their compliance performance?
Right. This is an internal audit, and so InterCare uses this to measure the capability of each adjuster and uses it as a performance tool to address that. So there's no state requirements for this. Obviously, if there was an audit and they failed to achieve paying temporary disability payments on time, paying permanent disability on payments on time, that could potentially open them up to penalties.
Even just one time you're talking about?
Yes.
Okay. So no goals that we have set then ourselves that we're looking for them to achieve? Or a red flag warning as far as the number that we're saying if it starts to dip below,
right?
When will we react?
Yeah, I discussed that with Intercare because at the last time we completed this audit, they were at 98% for total, and I saw a drop off there. They attributed that there was some change in turnover and staffing. From my standpoint, it should be 100%. I mean, that is the goal. Above a 90% is satisfactory.
Okay. But we don't, you're stating this as if it's not a policy. You're stating it as if it's your own personal sort of preference. So
Correct.
if somebody else was to step into the role, is there a set guideline that says this is the number?
Right. No, sir. There isn't anything in the contract or in the agreement that.
And Jennifer, any interest or any, thought on your part on having something that actually would be a trigger? That way, if it's not Eric or that somebody else steps in this role, that we have a number that we're looking for here?
Yes, I definitely think that that's something that we can take a look at. I do know the contract does have performance targets in it. I don't think that there's a number that's necessarily tied to it, though. I would agree with Eric. I think anything that gets below 90, we would want to start having conversations with them. But otherwise, I think looking at this, I'm pleased with their performance, given that we're only a year into this. They had a huge transition. We had a huge transition. I think that this is pretty good. Okay.
Pretty good, I would agree with. Eric in his presentation said 93% was still excellent. So that I didn't necessarily agree with. But pretty good, 93%, I would say yes. 98%, I'd say excellent. 100%, as you said, would be nice to achieve, would be perfect. And the reason why this actually intrigued me was for a couple reasons. Number one, we talk about the decrease of 15%, and that's obviously a positive thing. So I think of that as, okay, we're seeing these cases close. I looked at the number of staff. It's the same as it was on this last report, 11 senior claims examiners, 4 future medical or medical-only examiners, and 6 clerical staff. And then the average cases, though, looks like it went up a little bit from the 133.7 in this report, and then what was 139.9 average cases 6 months ago in that report. Looked, to me like there wasn't anything that stood out, right? That should have made a major change. It sounds like, Eric, your response was when you asked them that they said they had some turnover in staff, so maybe that related to some of these numbers dipping. But then I looked at the numbers to compare across the board to see really where there might be the biggest discrepancies. So the top line, if we were to go back to slide 7. So going down the list from 6 months ago, we had at the top a prior overall score of 98%, and then moving down, the 4 quality performances were 96, 96, 99, and 100% under the benefit payments. And then the state compliance, the first 3 were all 100%, and the last one, the agreed medical examiner, was at 96%, a slight increase this time around, which is the only increase, actually, section that had an increase. And so, for one, I would like to see in the next 6-month report an actual comparison, especially if we have something like this, a 5% drop. I'd like to see a comparison so that it honestly just saves me a little bit of time to have to sit there and then rattle these numbers off, and it doesn't benefit the rest of the public because they can't see that themselves. But then that way we can actually pinpoint is there an area that actually is of concern. For instance, right, you look at some of the bigger drops, like the temporary disability payment compliance went from 100% down to 93. I think that's a pretty big swing, right? And then an area where we were at 100%, the benefits payments, right, went from 100% to 97%. Some other big drops, the plan of action in claim notes every 90 days went from 99 down to 100, or excuse me, 99 down to 90, so a decrease of 9%. So I'm just kind of curious, right? I wanted to see what areas might be of concern. And across the board, right, all of them were concerning. A couple of them stood out. And this is not a trend that, I want to see continue. And so I appreciate hearing that for you, a warning sign would be about, dipping below that 90%. Seeing that it was literally near 100%, 98%, right, at the last report, and that we had a number of areas that they were hitting 100%, and this go around, not one place did they hit 100%. That's concerning to me. And, most everybody in the room, maybe not Eric, realizes how kind of fiercely I fought for this, right, to sort of stay in-house previously. Maybe you watched enough of the videos. But so I'm going to be picking pretty close, right, at the results here, and looking for areas of concern. And so this is certainly, for me, was not an improvement. It was not what I want to see. I'd love to see them stay at these high levels of results. And so I hope we can, for one, see that improve right in the next 6 months, but that we can also get a little bit more of a comparison on the numbers. So, and then maybe Jennifer, if you can look at putting something in more formal that would denote when we're actually going to consider something a warning sign or whatnot. If it's that 90%, then so be it, rather than just be a discretionary.
Yes. I do want to clarify one thing. When you're looking, so just for example, under state compliance performance, you're looking at temporary disability payment compliance. They audited 178 claims. Only 27 of them had temporary disability payments. So they're actually only looking at 27, and then 2 were no and 25 were yes. So because it's such a small thing, there could be a swing in that percentage just by 1 or 2 claims. So I just wanted to clarify that there.
We had this discussion with the independent police auditors report, right? And using statistics, right? Using percentages versus looking at actual hard numbers. So, I see that in here in the report, right? That we're talking about just a few cases, and so and that is in here spelled out, and so that's it's helpful as well. Nonetheless, overall, right? There's right where we are going for, and we should be unsatisfied unless we're achieving 100% or near 100% in some of these results, and if we're trending downward, we want to see what we can do to trend back upward. And the other thing is obviously what was stated in the end of your report, which is because we have now outsourced this completely, what that might allow our in-house staff to kind of focus on. And so in that regard, I would like to see in the next report, and maybe 6 months, may take you the whole year, but to see some of the potential benefits or the improvements or results that we might see from some of these new programs that we're able to begin working on in-house. If we can kind of quantify how those have been benefit. I don't know how easy that may be, but if you can creatively kind of think about that, I'm not demanding this come back in 6 months, but that we take a way of saying, what is the payoff? What has been the benefit of some of these in-house programs because we have freed up some of the staff time by outsourcing the actual work.
So we will definitely look at that. It is going to be a little bit difficult to piece out one thing. So like doing employee wellness screenings and catching something early because we did an employee wellness screening that then avoided a workers' comp claim. We're not going to be able to say that then showed a reduction. I think, but us overall showing that we're reducing our workers' comp claims, we're getting employees treated faster, we're reducing our 4850 people being out on the streets, we're reducing our costs, all of those together, I think, show the effect of what we've been doing.
Yeah, I agree. And so I just wanted to see a way to and if it's just reporting it a little differently in here that helps us highlight, hey, these things it's hard to connect it exactly, but there's something we think that we can show for some of this and maybe create a nexus ourselves. So that's all my questions. Any other questions, comments from my colleagues? Seeing none, if we can get a motion to approve the report.
Motion to approve.
Motion is second. All those in favor say aye.
Aye.
Aye, motion passes. We're now into open forum. I didn't have anybody turn in any cards, so meeting's adjourned. Thank you.